So when you arrive at the clinic, we'll get you checked in. We will ask you to put on a surgical mask, and we'll also be wearing the same, but for the purpose of the video, I haven't got this on. And when you come into this room here, this is the first room, one of the nurses or technicians will take you in. So my name is Liz and I'm one of the technicians. We'll take your temperature just with our thermometer, again, just in line with our protocol in terms of COVID. And we'll also measure your glasses prescription on this device here before we measure your prescription on this device. This is an autorefractor. And we'll also measure your intraocular pressure as well. So that's what you might know as the little puff of air test. We'll then take you down to another room where we'll use two devices to scan your cornea, which is that front part of the eye, and where our laser treatments are based. And things like the thickness and the curvature of the cornea will help us get started in terms of assessing your suitability before you head in to see the optometrist for their checks.
Hi, my name is Keane and I'm an optometrist here at the Wellington Eye Clinic. So this is the second stop that you'll make in your journey after seeing the nurses or the technicians. What we'll do is we'll talk to you about the different procedures that we have. We'll talk to you more about your lifestyles, your motivations, about why you want to get surgery done, and then also your current use of spectacles, contact lenses, etc. Then what we'll do is we'll measure your vision and we'll perform a check on the front surface of the eye. We'll be checking for dryness, and then we'll send you for additional scans and tests. We'll have a better idea of what procedures you might be suitable for, and then we'll dilate your pupils and you'll be in to see Mr. Cummings.
So this is the last stage of your journey. You've been through a long process already, and we're doing this so that we have all the information that we could possibly get to help you make the best decision. What I'm going to do is repeat your prescription. You'll be dilated at this point, so it allows us to make it really certain about what your prescription is, and then do a medical exam, and then also have a look at your peripheral retina. So we always make sure the retina's okay before we do any surgeries. I'm also going to again review your reasons for wanting to do it and review our options we have for correcting it. And so by the time you leave here, I would also have completed the consent form with you. On the odd occasion, there might be two procedures we're thinking about and we haven't made our decision yet. So I'll give you both consent forms, but most times we know exactly what we want to do. And I'll go through the consent form, not because you signed consent today, but because we like going through it very systematically and making sure you leave with a document that can remind you of the things you need to think about. But all in all, you're going to find this is the most advanced vision analysis you've ever had.